I'm washing my hands. Hi, my name is Courtney. I'm going to be your nurse for today. Can I please have you state your name and date of birth?
Christine Schultz, 11070.
Okay. And then do you have any allergies? And if so, what is the reaction?
No allergies.
No allergies? Okay. So currently what I'm going to be doing is assessing the patient's general appearance. So I can see that the patient does not appear to be in any distress. She is appropriately dressed for the weather. She has proper hygiene. She appears well nourished, and she does not appear to be breathing with any accessory muscles. So next what I am going to do is assess if the patient is alert and oriented to person, place, time, and situation. So can I please have you state your name and date of birth for me again?
Christine Schultz, 11070.
And then what is today's date?
December 3rd.
Okay. And then could you tell me where you are?
I'm at the doctor's appointment.
The doctor's?
Okay. Yeah, just to get a checkup.
Okay, and then that's the reason your situation?
Mm-hmm.
To get a checkup? Okay, perfect. So next, the patient is alert and oriented times 4. So next what I'm going to assess is if the patient can follow commands. So could I have you grab both my hands for me? Thank you. And then could you wiggle your toes? Okay, you're good. So the patient appropriately responds to commands. Next, I am going to assess for perla. So I am going to look at the patient's pupils. I'm just going to go ahead and shade some of the light here. So the pupils are about 7 millimeters and they are equal and round. I'm going to assess the reaction to light. So I'm going to first begin on this side. Okay, and I'm also going to, that was direct light exposure, and then consensual light exposure. I'm going to be looking at the opposite eye. So the pupils both respond to direct and consensual light exposure. The opposite pupil constricts when I shine the light in this eye. So I'm also going to be testing for accommodation. So I'm going to go ahead and look at this pen light and then just follow it as I bring it closer. So as I got closer, the eyes converged and the pupils constricted. So next what I am going to do is inspect the precordium. The chest is equal in size, and could I have you just unzip your sweatshirt? And then I am not observing any apical pulses. So next what I'm going to do is palpate the chest for any heaves or thrills and tenderness. So I just want you to tell me if anything hurts, okay?
Mm-hmm.
Sorry. Did anything hurt?
Mm-hmm.
Okay, so the patient did not report any pain, and I did not feel any heaves or thrills. So next what I am going to do is auscultate the heart. I'm going to begin using the diaphragm of my stethoscope. So I'm going to begin at the aortic area. Go ahead and move to pulmonic, down to Erb's point, tricuspid, and then mitral. So S1 was loudest at the apex and S2 was loudest at the base. Next, what I'm going to do is use the bell of my stethoscope to listen for any murmurs or extra heart sounds. So I'm going to go ahead and do that. Again, beginning at the aortic area, moving to pulmonic, Erb's point, tricuspid, and then mitral. So I did not hear any heart murmurs or any extra S3 or S4 heart sounds. So next what I'm going to do is assess the pulse points, and I will also be grading the pulses. So I'm going to begin at the carotid. I'm going to go ahead and have you hold your breath for me just for a second. So the carotid pulse is regular, and I'm giving it a 2+ grading. Next, I'm going to move down to the brachial pulse. So the brachial pulse is regular, and I'm giving it a 2+ grading bilaterally. Next, I'm going to go ahead and move down to the radial pulse. So the pulse is regular, and I'm giving it a 2+ grading bilaterally. Next, I'm going to move on to ulnar. See on again. So the rate is regular, and I am giving the ulnar pulse a 2+ grading bilaterally. Can I have you lay down for this next one? I'm going to feel your femoral pulse. Okay, so the femoral pulse is regular, and I'm giving them both a 2+ grading bilaterally. You can go ahead and sit up for me. I'm going to go ahead and feel the popliteal pulse next. So the rate is regular, and I'm giving them a 2+ grading bilaterally. Next, I am going to assess the posterior tibial pulse. So they are both regular, and I'm giving them a 2+ grading bilaterally. Next, I am going to assess the dorsal pedis pulse. And both of those are regular, and I am giving them a 2+ grading bilaterally. So next, what I am going to do is assess the extremities for edema. So can I just have you lift up your sleeve for me? Thank you. Okay, so the upper extremities are free of edema. And now I'm going to go ahead and do the lower. So the lower extremities are also free of edema. So next, what I am going to do is inspect the chest again for the anterior-posterior to transverse ratio, which is 1:2. And next, I am going to auscultate the lung fields. I'm going to begin with the anterior lung fields. So I'm going to start at the apex of each lung. And I'm going to be moving downwards and side to side using a step ladder fashion. And go ahead and take a breath for me each time I move. Thank you. Go ahead and take a breath. Take a breath. And one more time. Okay, thank you. So now I am going to go ahead and move on to the lateral lung fields. Can I have you just lift your arm for me? Again, I'm going to be moving downwards and side to side using a step ladder fashion. Go ahead and take a breath. Take a breath. Take a breath. Breath. One more time. Okay. Great. So next I am going to auscultate the posterior lung fields. Could I just have you turn around for me? Thank you. So each time I move my stethoscope, please just take a breath, okay? Just take a breath. Okay, so in the anterior, posterior, and the lateral lung fields, the vesicular lung sounds are clear. And next, oops, I'm sorry. So then, next thing I'm going to do is assess the abdomen. So go ahead and lay down for me, and then go ahead and lift your shirt up if you don't mind. So I am noting that the skin color is pale over the whole abdomen. There are no differences in the skin color. I'm noticing just some small striae, and then I am not observing any hernias. So next I am going to assess the shape of the abdomen. So it is slightly rounded, and there is a symmetrical abdomen. So next what I am going to do is auscultate the bowel sounds in all 4 quadrants. So I'm going to go ahead and begin in the lower quadrants. And right now I am in the right upper quadrant, left upper, and left lower. So I am hearing vowel sounds in all 4 quadrants of the abdomen. Next, what I am going to do is just percuss the abdomen. I'm going to begin again in the right lower quadrant. So the prominent tone is tympani over the abdomen. Next, what I'm going to do is lightly palpate the abdomen for any pain. And then I just want you to tell me if anything hurts, okay?
Okay.
Is there any area that's hurting you right now?
No.
Okay. So did you feel any pain?
No.
Okay. So next what I'm going to do is deeply palpate the abdomen. And then I'm going to be feeling for any masses. I'm just going to be feeling for the organ structure. And then again, if anything really, really hurts, I know this isn't going to be comfortable, but please just tell me. Okay, did anything hurt too bad?
No.
All right, and then I did not feel any masses or abnormal structures. So next what I am going to do is, I can just have you sit up really quick. I'm just going to assess the skin color. It is even across the entire body. I am not observing any open wounds, any drainage, or let me just see your arms and stuff. Any open wounds, drainage, any contusions, rashes, lesions, nothing. The skin looks very healthy, and now I'm going to assess the temperature. And then also the moisture. So the skin is warm and dry across the entire body. And now what I am going to do is assess the strength. I'm going to first begin by assessing the upper extremity strength. I'm going to grade this also when I'm done. Go ahead and squeeze my hands as hard as you can. Okay, so I'm giving the upper extremity strength a 5 out of 5 grading. And then go ahead and lean back on the bed. And then could you kind of like just scoot back and put your legs up if you don't mind. Okay, so I'm gonna go ahead and push against some resistance, or I'm gonna push your legs out and then just try and resist. Okay, and then I'm gonna just spread them just a bit and then resist my pushing. Okay, so I am giving the lower extremity strength a 5 out of 5 grading. And then you can go ahead and sit up. I'm actually gonna do your upper extremities one more time. I just want you to hold your arms up and then resist against my pushing. Okay, so again, I'm giving the upper extremity strength 5 out of 5. So I am done with the assessment. Do you have any questions?
Nope.
All right, thank you. Have a good rest of your day.
You too. Thank you.